Cystitis refers to the inflammation of the bladder, often caused by a bacterial infection, irritation, or damage. Cystitis is most commonly caused by a urinary tract infection, or UTI. Non-infectious cystitis can also occur due to certain drugs, such as NSAIDs, or following pelvic radiotherapy and some chemotherapy medications used in cancer treatment. In women, cystitis often occurs when bacteria from the anus enter the urethra. This can happen during tampon insertion, sexual activity, wiping back to front after using the toilet, or using a diaphragm for contraception. Cystitis can also be caused by irritation or damage in the urethral area for both men and women. This can result from changing a catheter, vigorous or frequent sex, sometimes called honeymoon cystitis, a wearing tight clothing, exposure to chemical irritants like perfumed soap or talcum powder, other bladder or kidney problems, such as a kidney infection or prostatitis, and diabetes, due to excess glucose in the blood. Cystitis is more common in women due to the shorter length of the urethra and its close proximity to the anus, making it easier for bacteria to reach the bladder. Nearly all women will experience cystitis at least once in their lifetime, and 1 in 5 women will have recurrent cystitis. It is more likely to occur in pregnant women, sexually active women, and postmenopausal women due to reduced estrogen levels, which can thin the lining of the urethra and bladder, increasing susceptibility to infections. While cystitis is less common in men, it can be more serious. Men who have sexual intercourse with other men are more likely to experience cystitis. Common causes in men include a bladder or prostate infection, such as prostatitis, and a urinary tract obstruction, such as a tumor or enlarged prostate. Symptoms of cystitis, in both men and women, include pain, burning, or stinging when urinating, frequent and urgent need to urinate but only passing small amounts, dark, cloudy, or strong-smelling urine, blood in the urine, pain above the pubic bone, lower back, or abdomen, and feeling unwell, weak, or feverish. Cystitis in children may cause weakness, irritability, reduced appetite, vomiting, and pain when urinating. Refer to a healthcare professional if it is the first time the patient has experienced cystitis, if the patient is under 16 years old, to rule out structural abnormalities, if over-the-counter treatments have failed, if vaginal discharge is present, as this is more likely a vaginal infection rather than cystitis, if symptoms worsen or suggest an upper UTI, such as fever or loin pain, if the patient has had cystitis more than 3 times in 1 year, or if symptoms persist longer than 5 to 7 days, as this may indicate the infection has spread to the kidneys. For mild cases of cystitis, over-the-counter painkillers and increased water intake can help. Paracetamol is recommended as the first-line pain relief option. Patients should be cancelled on proper dosage, 1 gram up to 4 times a day, not to be combined with other paracetamol-containing products. Although NSAIDs like ibuprofen can be effective for pain relief, their use is cautioned in UTI patients, as they may reduce kidney blood flow and increase the risk of complications. It is also advised to avoid sexual activity until cystitis has cleared. Traditional treatments like urine alkalizing agents, such as sodium bicarbonate or potassium citrate, and cranberry juice are no longer recommended due to insufficient clinical evidence. Cystopurin is an over-the-counter alkalizing agent used to relieve cystitis symptoms by reducing urine acidity. It contains potassium citrate and is available as a cranberry-flavored 48-hour treatment. Patients should dissolve 1 sachet in 200 milliliters of cold water and take it 3 times daily for 2 days, completing all 6 sachets. While taking cystopurin, avoid alcohol, fruit juices, coffee, and strong tea, and stay hydrated with water. It is best to take the product with or after meals to avoid stomach irritation. If symptoms persist after 48 hours, seek medical advice. Cystopurin is not suitable for people with phenylketonuria and should be used with caution in patients with cardiac conditions. Pregnant women can use it, but GP referral is advised. There may be interactions with potassium-sparing diuretics, ACE inhibitors, and cardiac glycosides like digoxin, so caution is recommended. While it's not always possible to prevent cystitis, there are several steps you can take to minimize the risk of recurrence. Avoid using perfumed bubble bath, soap, or talcum powder in the genital area. Opt for showers instead of baths to limit exposure to chemicals and cleaning products. Always fully empty your bladder when you go to the toilet. Don't delay urinating when you feel the need. Wear cotton underwear and avoid tight jeans or trousers. And always wipe from front to back after using the toilet. Some foods and drinks, such as coffee, fruit juice, or spicy foods, may trigger cystitis in certain individuals. If you notice a pattern, consider avoiding these triggers. While cranberry products are not effective in treating cystitis, they may help prevent recurrent infections. High-strength cranberry capsules, 200 milligrams of extract, can be recommended. However, cranberry products are not advised for patients taking warfarin, as they may interact. For patients whose cystitis is triggered by sexual intercourse, the following steps may help. Wash your genital area and hands before and after sex. Use a lubricant during intercourse to prevent genital irritation. If you use a diaphragm, spermicide, or spermicide-coated condoms, consider switching to another form of contraception. And after sex, empty your bladder as soon as possible to flush out any bacteria. When changing a catheter, take special care to avoid damaging the genital area and to reduce the risk of infection.